Welcome to brain4care. This video covers the basics of the non-invasive intracranial dynamics monitoring sensor, including setup, sensor placement, navigating the app, and more. Part 1. Unboxing and charging your brain4care device. On the inside of the case, you will find the Quick Start user guide with QR codes and links to other resource materials. This guide also provides important safety information. Before removing the sensor, please review these safety precautions located on the bottom section of this printed guide. Now let's begin unboxing your device. The storage case includes a magnetic slot for the tablet, the brain4care sensor, the adjustable headband, and the wireless charging dock that includes a USB charging cable and power brick. If your facility is using the brain4care workstation cart, the tablet is located on the adjustable arm, and the drawer will include your brain4care sensor, adjustable headband, and charging dock. If the cart is plugged in, your sensor will automatically charge when being stored. Before using the sensor for the first time, we recommend charging it fully. A full charge from 0 to 100% takes approximately 2 hours. Once fully charged, the battery is good for up to 10 hours of continuous use. Part 2. Setting up the brain4care app. When you're ready to begin a monitoring session, open the brain4care app and log in. Next, assemble the sensor and headband using the outer pegs. Please note the outer pegs are for adult use, while the inner pegs are for pediatric use only. Lastly, power the sensor on by pressing and holding the gray indented button on the top of the sensor. Manual Bluetooth pairing between the sensor and the tablet is only necessary for the initial setup of the sensor. After that, the sensor will automatically pair with the app when it is powered on. Once the app is open, there are 4 required input fields. These include name, MRN, date of birth, and sex. The MRN allows for stacked reviewing of past monitoring sessions in reverse chronological order. If you have an urgent case, the app allows you to skip data entry and begin monitoring immediately, allowing the operator to complete the required fields after the monitoring session is completed. Other optional patient data fields can also be filled out anytime before, during, or after a session, but are not required to save a session. These fields include medications, physiological support interventions, and other relevant clinical data. Before confirming a monitoring session, click on the Report Category option and select a tag. Tag options include clinical, research, and demo. All patients being monitored should be filed under the clinical tag option. After a patient has been monitored and their data has been entered and confirmed once, the user can select the Repeat Session option for subsequent monitoring sessions, allowing the ability to bypass re-entering the patient's data. The Repeat Session option can be accessed from both the report page and the home page in the app. Part 3. Patient positioning, headband positioning and tightness, and LED halo and banner guidance. Click the Start Positioning option in the app and begin positioning the patient. When positioning the patient, place the head of the bed to 30 degrees and align the body in the supine position with the neck aligned to midline. Maintain a neutral body position with the head centered, arms resting alongside the body, and legs fully extended. If the patient is conscious, this is the correct time to educate them on proper body mechanics for a brain4care monitoring session. This includes remaining as still as possible with eyes loosely closed and specifically avoiding any facial movements, jaw clenching, talking, or laughing. Begin positioning the sensor by fully opening the turnbuckle and positioning the sensor over the left or right frontotemporal region as shown at points A or B on the diagram. While these are brain4care's recommended placement locations, the sensor can also be placed at other circumferential locations. However, alternative locations may result in a waveform with more artifact. The goal is to position the sensor over flatter, bony areas with less soft tissue, which can help achieve a cleaner waveform with less artifact. The sensor LED halo color indicates the tightness levels. When the LED halo and banner in the app are blue, this indicates the correct tightness level. If you see a red LED halo and banner, that indicates the sensor headband is too tight and will need to be loosened. A yellow LED halo and banner indicates the headband is too loose and will need to be tightened. Next, slowly tighten the turnbuckle to firmly secure the device to the patient's head and follow the guidance in the app and on the sensor to obtain the correct tightness level. Part 4. Assessing the waveform. At this stage, it is essential to verify appropriate waveform morphology to ensure a high level of quality data collection. The brain4care software does help to evaluate signal stability and waveform consistency, as well as providing a confidence index. However, clinical users must always check the waveform at this stage to confirm appropriate shape and similarity to a traditional invasive waveform. Here you can see examples of good waveform morphology consisting of clean uniform waveforms with no artifact or uniform consistent waveforms with a low amount of artifact. These are examples of poor waveform morphology. They do have a repeating waveform, but with a high amount of artifact. Please note that any waveform with more than 3 peaks should be considered artifact, and the brain4care device should be repositioned for correct placement. Part 5. The monitoring session. Once you start the session, you will be able to monitor the surrogate ICP waveform and trend the cerebral dynamics values in real time on the app. During the session, you can use the Clinical Events tab to notate changes in patient condition, patient movement, or sensor repositioning. You can also log medication administrations and other clinical changes throughout the session. If the sensor is accidentally moved or requires repositioning, the Check Waveform feature is available under the Quality Check tab to reassess the waveform for consistency during an active session. The user also has full control to pause the monitoring session at any point to perform patient care if the need arises. Afterward, you can easily resume monitoring or end the session. The pause feature can also be used when the user must rotate the sensor site every 2 hours to prevent skin irritation or breakdown. If the contralateral site is used for a new monitoring site, don't forget to notate this change in the Clinical Events menu. At the end of a session, a compiled PDF report of the session data, including waveforms, P2 to P1 ratio, and normalized time to peak values is created. Please note that a pause during the monitoring session will appear as a gray bar in the PDF report during the minutes that the monitoring session was paused. A blue bar appearing in the PDF report indicates a period of monitoring containing more than the acceptable level of artifact for processing for that time interval. This report will also stack any previous PDF reports for easy review of trends. Part 6. Cleaning your brain4care device. After use, sanitize the sensor and its components using approved medical wipes or recommended cleaning supplies such as ethyl or isopropyl alcohol wipes, alcohol swabs, or chlorhexidine wipes. If you have additional questions about the brain4care sensor, app, or anything else related to the use of our monitoring device, please promptly reach out to our brain4care clinical support team. Thank you for choosing brain4care. We have your health in mind.